Men are sinners. When I say men, I mean mankind in general. But somehow we believe, or some of us believe, that handing over power to the government will somehow end well for us. In private organizations, men sin. They're shady. They do things we don't like, but they have competition. If Company X does something that you don't like, you may go to Company Y, who has decided we're going to be a little more ethical. That company goes out of business. Now, this doesn't mean that you won't have bad companies. This doesn't mean that just because you have competition means you get rid of evil, but you have options. When you give the government control, the government who is made up by man, then you have man who will sin. We are sinners. You may not believe that. At bare minimum, you believe that within man is capable to do evil. Within all of us, there's that capacity and capability. And oftentimes, when you get people together with unchecked power, you will have evil. So, in what universe do we think handing over power to something such as healthcare to the government would end well for us? I think we have a good example of what would happen if we do this just in watching our neighbors to the north, Canada. Now, I want to take you to this article that I have pulled up from the Epoch Times about some things going on in Canada when it comes to healthcare that I found quite alarming. And to those who would think that handing the power of healthcare over to the government would end good for us, I'm here to tell you I do not think in any circumstance that this would be the case. So let's see what this article says. So this article was written by Marnie Cathcart. I believe that's how you say her name. Title of the article: Over 3.2 million Canadians on medical wait lists, according to new report. Now, there's some startling things in here. I'm just going to read a little bit of it. The latest government data indicates that 3.2 million Canadians are on the wait list for surgery, a diagnostic scan, or specialist treatment, according to the think tank secondstreet.org. The latest data also suggests that 41,487 patients have died on a waiting list since 2018 and 2019. This estimate includes cases where patients died while waiting for surgeries that could have potentially saved their lives. For instance, in 2020-2021, the Nova Scotia Health Authority noted there were 367 patients who died while waiting for surgery. Of those, 51 died while waiting for a procedure that could have potentially saved their lives. This makes me think of a story of a friend of mine I was in the military with. He was older than me, getting ready to retire. I'm a young man, 21 years old at the time. And I met his wife. His wife was from Holland. Very nice people. I got the opportunity to meet her dad maybe a year after meeting him. We met in church. We were both going to a church. And her dad was a very interesting cat. Lived during World War II, survived that. He told me some interesting stories. I can't remember much of them. I was 21 years old at the time. And honestly, I wasn't paying enough attention, nearly as much as I should have been. Year passes, and a year and a half or so, and her dad passes away. I felt bad. This man survived so much. And of course, he was older, and I'm sure he lived a full life. But I remember her being slightly upset. And I remember there were some things she was saying at the time. I wasn't really giving much attention to socialized medicine, the private healthcare system, and the differences and which one was better. I just honestly didn't give much thought to these things. Not that I wasn't politically engaged at all, because I was, but these are just things I didn't think about. And I remember her telling me her dad had some physical pains. He didn't know what it was, and he got put on a wait list. And he had to wait, I want to say, for a year and a half or so. Don't quote me on that number. It's approximate. It was a long time. By the time they saw him, they discovered that cancer had riddled his body. There was nothing they could do about it. Now, I don't remember all the exact details. It was many years ago. Lord willing, I'll be 44 this year. I was a 21-year-old young man at the time. I remember her saying that if they would have seen him earlier, they could have treated his cancer and he would have lived at least for a couple more years. Who knows how much longer, but he would have lived. That's something that has always stayed with me. And I remember her talking about the healthcare system in Holland. Now, I'm not going to feign to you that I know everything about that healthcare system, but from what I gather talking to her, from what I remember, it was a socialized healthcare system. And it definitely did not work out for her father. And what it looks like, this is not working out for Canadians. Now, I don't know everything and the ins and outs about healthcare in Canada, but I pulled up this article from Ross University School of Medicine. And this was written in 2021, May of 2021, the 11th. And there were some things in here that I thought, this is interesting. Now, what I've always heard is that in Canada, there's a mix of public and private healthcare, which to me, I'm like, okay, so they have government healthcare, but they can go out and purchase their own healthcare if they want. This is what I thought. But in this article, I found something out that I did not know. Let me see if I can get right to it, because this was actually very interesting. I think it might be in this second paragraph right here. It says, in Canada, the national government funds health insurance. Most of the services patients would receive from a hospital or general practitioner's office are covered by government insurance. According to the National Center for Biotechnology Information, NCBI, it is actually, listen to this, illegal in Canada for private insurance to cover services covered by government insurance. Did you hear that? It is illegal for private insurance to cover services covered by government insurance. Now, this is where I take issue. I always hear these glowing things about Canada's healthcare, about nationalizing healthcare, creating some government program, and the things that it will do for us. Now, I'm sure that somebody somewhere maybe had what seemed to be sound reasoning for this. But what they've done is they've created a monopoly. The government has control of whether you get treatment for an issue or not. Now, if it was a system where there was government health care and you could go get your private health care, and let's say you were on a wait list for a certain surgery, you could say, you know what? I'm paying for my own insurance. I'll pay a little more out of pocket and I'll go get this thing done privately outside of government health care. That's illegal. You can't do that. Now, I don't know about you, but that does not sound like a good deal to me. That does not sound like a good deal at all. Now, what would make a person agree to such a law? Again, to someone, this may have seemed completely rational, but in my humble opinion, this is solely irrational. This article right here goes on to say, thus, Canadian healthcare is a single-payer system, according to Harvard Health Publishing. The Canadian healthcare system was established by the Canada Health Act of 1984. I'm not going to bother looking into all of that because this would go much deeper if I looked into all of that, I'm sure. But that's alarming. Canada's healthcare system, I've always heard people who argue for socialized medicine, mention countries like Canada and how great their healthcare is. Now, I am not telling you that private practice solves all problems. You don't get rid of evil just because you have private practice, but I will tell you what you do have. You have more power and more options in your hand. If healthcare provider X won't do X or there's a long wait list, you can go to some other place. I can tell you in my time, I've had health insurance since I was 18 years old. When I was in the military, yeah, the military's insurance, it's good. I'm not going to, make it seem like it's trash. It's not, but it's not the best. Got out the military, got private health insurance, and not all my experiences have been grand. I'm not telling you that, but I haven't had terrible experiences. Whenever I've needed something done, there's never been at some extraordinary wait. And if there was a wait, I could always go somewhere else. I wasn't locked into one place. I wasn't locked into doing one thing. Yeah, it may cost more sometimes to go out of network, but that's always an option. It is crazy to think that there are people that could have been treated, but there was this long wait list and they died, and really they could have survived had they just been treated sooner. That's hard to fathom. That's something that if that was my mother, my father, my brother, my wife, my child, my friend, man, that would not sit well with me. That would actually probably haunt me. Just knowing that, man, if they would have just been seen a day earlier, 2 days earlier, a week earlier, they'd still be here today. Now, I'm not God, and I ultimately can't say when a person lives or dies. Right? I have no control over that. None of us have any control over that. But I just believe wholeheartedly. I'm not necessarily against the government having anything, but let's just say I am insanely skeptical of government at every end. I believe it was Thomas Paine that said, at best, government is a necessary evil, at best. But when we see government as the end all be all and the answer to everything, as though there will be no problems, understand this. The power you have is in the private market, you have more control. Again, I am not telling you the private market solves all issues. That's not my point. But my point is, in the private market, you have a say. Now, yes, businesses screw people over all the time. And the healthcare system is definitely one where people get screwed over on a regular basis. But you have more power in your hands to take action. When you give the government control of things like this, one, they're probably never going to give that control back. You're probably done at that point. I'm not saying that emphatically, but it's a high probability that you are done at that point. And the government has no obligation to help you, and you have no power to move them any faster. None. And we see this play out in that Epoch Times article. It's kind of startling. It's an article, if you are subscribed to the Epoch Times, I would highly recommend you going to read that article. It is something. I read through the whole thing and it really shocked me. And as I said, I thought, okay, this is, maybe these people couldn't afford it, which that's a whole nother issue. But I said, they have, a mix of public and private. So maybe there's more to this than meets the eye. Then when I found out reading that other article, it is illegal for a private practice to offer you a service that the government offers you. I thought, my goodness, you're locked in. If you need this thing, if this thing is needed for you to survive and you're on that wait list, God help you. This was a hard article to read. I'll be honest with you, it was a hard one to read because as I read through, I thought about friends that I have in Canada. What would happen if one of them were to get sick? and needed aid and had to wait weeks, months, years to be seen. This is what happens when you hand power and control over a thing, anything, to the government. The government is not benevolent. The government is not made up of people who are so much better than you that they understand this thing better than you do, and they will just do a better job because somehow when they put on that government moniker, they are now benevolent. That is not the case. They are men and women just like you, flawed just like you. The only difference is governments, unfortunately, in many cases have unchecked power. So when they do something that is to your detriment, you almost have no recourse. Now, I'm thankful to live in the United States, and we definitely have more recourse than others. But that recourse in some ways is feigning. But again, to me, this was a very huge warning to anyone, especially in the United States, that would be a fan of giving government control of healthcare. I'm here to let you know that will not work good for any of us.